Okay, so welcome to the Endocrine System quiz night. This is the first of many quiz nights that I'm going to host. The first for the endocrine system. You may have joined the infection quiz night last month. I'm hoping to have a lot of more of these sessions covering more topics. So just keep a lookout over the next few weeks. So in terms of the session, if you haven't joined me on Instagram, which you possibly heard of this platform through Instagram, then it's at MicroPharm. If you haven't subscribed to the YouTube channel, there's a lot of useful videos on the YouTube channel. And in terms of any study content, all of that is kept on micropharm.org. Even the links to the crash courses, which I'll briefly speak about later. So the first question I want to ask is, how confident do you feel and how prepared do you feel when it comes to the endocrine system chapter? So let me just relaunch this poll and then you can let me know. So how prepared do you feel with regards to the endocrine system chapter? So the consensus is the majority not prepared at all. So hopefully the large proportion of you are sitting the exam next summer, in which case there's plenty of time for you to engage with any sessions that I have or any content that I have, and you've got plenty of time to revise the chapter. We'll go, hopefully some of the questions that we go through today will help, because I intend to explain the answers for any of the questions that I ask. The format of the questions will be single best answer, just as the majority would be in the clinical proportion of the GPhC exam. So you'd expect 90 questions out of the 120 from the clinical paper to be single best answer, so the format that we're using today. So again, all questions will be via the poll. So Mrs. Insulin is 32. She's newly diagnosed with type 1 diabetes mellitus. She's struggling to remember the blood glucose concentration targets, and she's walked into your community pharmacy with some questions. So I'm going to launch a poll now. And the question is, what is the target fasting blood glucose level on waking for Mrs. Insulin? So just waiting on a few more votes. So we're split between C and D. So we're split between 47 millimoles per liter or 5 to 7 millimoles per liter. So is anyone confident enough to say why they strongly believe their answer in the chat box? We got 8 votes for each. Anyone? So the correct answer was 5 to 7, exactly 5 to 7, and 4 to 7 is before meals or throughout the day. Now, from my experience of diabetes mellitus and my experience working in a diabetic clinic, I normally manage patients with diabetic foot infections. The reason why I presume that these levels, these target levels are higher is because of one extremely risky thing, and that's nocturnal hypoglycemia. So hypoglycemia that can occur at night. This is a very high risk with the large majority of diabetic patients. I'm type 1 diabetic myself. And one of the main things when I'm in a consultation talking about hypoglycemia or any hypoglycemic events that I have throughout the day is the key importance of avoiding hypoglycemia during the night. The reason for this is because the large majority of patients may wake up. However, if you lose your hypoglycemic awareness, then hypoglycemia at night could easily lead to a diabetic fit or coma. So the key importance is when you have no control over looking at your blood glucose levels during that night, it's safer to go for a higher target range, 5 to 7, rather than when you're fasting throughout the day, where the target is 4 to 7. Does everyone understand that before I move on to the next question? Yep. All right, let's move on to the next question. Question number 2, Miss Sweet is 45. She has type 2 diabetes mellitus and her HbA1c level has increased since her last diabetic review, despite an improvement in diet and exercise. Her general practitioner would like to commence her on a new anti-diabetic medication. She's currently on Metformin alone. This is a past medical history. Which one of the following agents is contraindicated with Miss Sweet, not Miss Smith? Wait for a few more people. 60% have answered so far. So the large majority of you answered pioglitazone, and that's correct, pioglitazone. And why is pioglitazone contraindicated for Miss Sweet? So can anyone explain why? Exactly. She has heart failure. So she has left ventricular heart failure. Because of this, it's contraindicated. So anyone with a history of heart failure, pioglitazone is contraindicated. And this is largely due to the MHRA warning, as there's an increased incidence, particularly in patients taking pioglitazone with insulin, there's an increased incidence of heart failure. So it's being monitored very closely. And for this patient group, it's contraindicated. So let's move on to the next question. For the next question, you're allowed to use the resource of the BNF. So very similar to C as you would in the GPhC exam, you'll normally have the resource provided to you in the assessment. So the next question is, Mr. Sucrose is 48. He has type 2 diabetes mellitus. His GP plans to commence him on sitagliptin. However, his renal function, may impact the dose that should be prescribed. His estimated glomerular filtration rate is 41 milliliters per minute. What dose should Mr. Sucrose be prescribed? The resource that you need to use is here, and I will relaunch the poll now. So we've got 70% of people have answered so far. We'll just wait for a few more seconds. So the correct answer was B. It's 50 milligrams once daily. So if you look at the monograph, you will look for the renal impairment portion of the monograph, and it will speak about dose adjustments that may be necessary. So when you look at a patient with an eGFR between 30 to 45 milliliters per minute, the manufacturer recommends that this patient should be reduced to 50 milligram once daily. If Mr. Sucrose doesn't have any renal impairment at all, what would be the normal dose for sitagliptin? Let me know in the chat box. Perfect. Yes. So it should be 100 milligrams. We're reducing it to 50 milligrams purely due to the renal function. Right. Let's move on to the next question. A 53-year-old patient with type 2 diabetes mellitus has commenced on a new medication. He's advised by his GP that there's a rare risk of diabetic ketoacidosis associated with the new medication. Which of the following medications is he likely to have been prescribed? Okay, so the correct answer was B. It was canagliflozin. So canagliflozin, sorry, I just got knocked off by the question. Yeah, so with this question, you wouldn't be expected to use the BNF for this one. This is something that you should have an understanding of without the BNF. And the likelihood is if you're asked a question like this, you wouldn't be provided a resource. So the correct answer was canagliflozin. Which drug class does it belong to? So what we know is the European Medicines Agency, the EMA, have found that there are rare cases, but there were life-threatening cases of DKA associated with SGLT2 inhibitor use. And these DKA presentations have very strange presentations where the patient's blood glucose levels are not extremely high, where you would expect it to be with SGLT2s. So the problem associated with this is not, the problem associated isn't fully understood. So the presence of DKA with these patients isn't fully understood. However, these risks should be communicated with patients. And there are some cases, if a patient's going for a surgical procedure, for example, you may need to stop the patient's therapy and monitor their ketones during treatment as they are at increased risk of DKA. So the next question is, a 54-year-old patient with type 2 diabetes mellitus walks into your community pharmacy with a prescription for a new medication for her diabetes. She is concerned as she has read a news article about this new medication stating it increases the risk of bladder cancer. Which of the following medications is he likely to have been prescribed? So the large proportion of you did get this right. This was pioglitazone. So there's a small increased risk of bladder cancer associated with pioglitazone use. However, because of the fact that it's such a rare side adverse effect and the benefits of pioglitazone outweigh the risks, they are continued to be used. However, their use is monitored and there is a warning with regards to this. So the next question, which of the following medications is an example of a biguanide? So the large proportion of you got this right. It's metformin. Metformin is the gold standard treatment for patients with type 2 diabetes. There's a lot of benefits with regards to metformin. What is the benefit of using metformin compared to other therapies? Yeah, so there is the benefit of weight loss, and the benefit of weight loss is associated with the fact that it decreases patients' appetite. There's a reduction in the risk of hypoglycemia, which is very important. This is largely due to the fact that it doesn't impact insulin secretion. So that's very important. It prevents the formation of new glucose. So it reduces gluconeogenesis. So there's a lot of benefits associated with the use of metformin. And that's why you'd expect a large proportion of patients to be commenced on this if they are to be commenced on a therapy for type 2 diabetes mellitus. So those are the 6 questions that we had for today. I'm hoping for all of these sessions to fit within the half an hour window. I'm hoping to have another session next week. I will be having a session. On next week on the infection chapter. It's going to be a 2-hour session. So the 2-hour session will be covering the infection chapter as in over 1 hour, and there'll be questions throughout the session, but at least 1 hour of questions. So really, I'm trying to target those that feel like they're not prepared with the infection chapter for the exam sitting in November, but anyone for the July sitting is free to attend it. Anyone who's attended these sessions will receive 50% off that session next week. So if you are interested, do drop me a DM. And I'll just have a chat with you about the endocrine system crash course. So Zainab, it's 6 questions in total. I will be uploading the quiz night the next week, so I'll upload it on YouTube. So anyone who's missed some of the questions, you can watch it on YouTube next week. And anyone who's attending the session can receive 25% off the question pack that I have on MicroPharm.org. This includes 25 GPhC style questions for the endocrine system chapter. If you want that, just use member 25 on MicroPharm.org. And if you want to access the endocrine system study guide, which is a 58-page study guide, where it's a comprehensive study guide on the entire BNF chapter, but it breaks it down so you can really just get the high yield points from the study guide. That's for 25% off, that's member 25. But the main thing, if you do want to take a lot of learning away, is the crash course. The crash course is on micropharm.uk or micropharm.org/crash courses. This is where I have over 40 videos on the endocrine system chapter. I've delivered this session to over 500 provisionally registered pharmacists and trainee pharmacists. So this is the best course that I have for you for the endocrine system chapter. There's a mock assessment, over 40 videos, and also the study guide that's included, and you can get £10 off that by just using the code WELCOME. So if you are struggling with the chapter, you can access this course, and you'll remain accessible to the course for as long as you have access. Essentially, there's unlimited access, and you can watch it as many times as you like. So hopefully you found this useful. If you did find it useful, drop me a DM just to give me some feedback so I can share that for any further sessions. And hopefully I'll see you on the next session. Thank you for everyone who attended.